Hi, this is M. Mano Yogabiga, Department of Pharmaceutics, Assistant Professor, School of Pharmaceutical Science, VISTAS. Today's my topic is about tablets. Definition for tablet. According to USP, tablets is defined as a compressed solid dosage form containing medicaments with or without excipients. According to Indian Pharmacopoeia, tablets are solid, flat, or biconvex dishes, unit dosage form prepared by compressing a drug or a mixture of drug with or without diluents. Advantages and disadvantages of tablets. So advantages: it is easy to administer, easy to dispense, more stable, its accuracy in dosage, and bitter and nauseous substance can be easily dispensed. It is economical and light and compact. The disadvantages of tablets: problems with compression to crystalline drugs. Hygroscopic drugs are not suitable for compressed tablets. So drugs with low or poor water solubility, slow dissolution may be difficult to formulate. The swallowing is difficult, especially for children, and which means they are an unconscious patients. So this is the mechanism of a tablet disintegration in the blood. So first tablet will be disintegrated into granules, and further upon it disaggregates to form a primary drug particles, and moderately the granules will dissolution in the drug, and then it enters into the drugs enters in the gastrointestinal fluid, and absorption takes place in the blood. Types of tablets. So tablets injected orally, tablets used in oral cavity, tablets administered by other route, and tablets used to prepare solution. Tablet injected orally, like compressed tablets, multi-compressed tablets, multi-layer tablets, sustained action tablet, entry coated tablets, film coated tablets, sugar coated tablets. Tablet used in oral cavity: buccal tablet, sublingual tablet, lozenges, dental cones. Tablets administered by other route: implantation tablet, vaginal tablet. Tablets used to prepare solution or effervescent tablet, dispersible tablet, hypodermic tablets, and tablet triturate. So first, tablet injected orally or compressed tablets. These tablets are formed by compression and contains no special coating. They are made from powdered, crystalline, or granule material alone or in combination with suitable excipient. These tablets contain water-soluble drug which after swallowing get disintegrated in the stomach, and its drug content are absorbed in the gastrointestinal tract and distributed in the whole body. So example is aspirin and paracetamol tablets. Multi-compressed tablets, it is also called as layered tablet. So these are compressed tablet made by more than one compression cycle. Such tablets are prepared by compressing additional tablet granules on a previously compressed granulation. The operation may be repeated to produce multi-layer tablets of 2 or 3 layers. To avoid incompatibility, the ingredient of the formulation except the incompatible material are compressed into a tablet, and then incompatible substance along with necessary excipient are compressed over the previously compressed tablets. Sustained action tablet. So these are the tablets which after oral administration release the drug at the desired time and prolong the effect of the medication. These tablets when taken orally release the medicaments in a sufficient quantity as and when required to maintain the maximum effective concentration of the drug in the blood throughout the period of treatment. Example is diclofenac sustained release tablets. Entry coated tablets. These are compressed tablets meant for administration by swallowing and are designed to bypass the stomach and get disintegrated in the intestine only. These tablets are coated with material resistant to acidic pH of the gastric fluid but get disintegrated in the alkaline pH of the intestine. Sugar coated tablet. These are compressed tablets containing a sugar coating. Such coatings are done to mask the bitter and unpleasant odor and the taste of the medicament. The sugar coating makes the tablet elegant and it also safeguards the drug from atmospheric effect. Example, multivitamin tablets like B complex tablet. Film coated tablets. The compressed tablet having a film coating of some polymer substance such as hydroxypropyl cellulose, hydroxypropyl methyl cellulose, and ethyl cellulose. The film coating protects the medicaments from atmospheric effect. Film coated tablets are generally tasteless, having light increase in the tablet weight and have less elegance than that of sugar coated tablets. Chewable tablets. These are the tablets which are required to broke and chewed in between the teeth before injection. These tablets are given in the children who have difficulty in swallowing and to the adults who dislike swallowing. Example are antacid tablets like Digene, Gelusil, etc. Tablets used in oral cavity, buccal tablets. These tablets are to be placed in the sides of the cheek where they dissolve or erode slowly and are absorbed directly in the buccal cavity without passing into the alimentary canal. Example, progesterone tablet. Sublingual tablets. It is a tablet which is placed under the tongue where they dissolve or disintegrate quickly and are absorbed directly without passing into gastrointestinal tract. Example, tablets of nitroglycerin. Lozenges tablet. These are the tablets which gives a local effect in the mouth or throat. These tablets are used for the sore to control coughing in common cold. They may contain local anesthetic, antiseptic, antibacterial effect and astringents. Example, Vicks lozenges stepsils. Dental cones. These are the compressed tablets meant for placement in the empty circuits after tooth extraction. They prevent the multiplication of bacteria in the socket following such extractions by using slow-releasing antibacterial compounds or to reduce bleeding by containing the astringents. Tablets administered by other route. Implantation tablets. So these are the tablets meant for minor surgical operation and are slowly absorbed. These may be made by highly compression but are normally made by fusion. These tablets are very useful, exploited for birth control in human beings. Vaginal tablets. These are the tablets which dissolves in the vaginal cavity. The tablets are typically ovoid or pear-shaped for the ease of injection. These tablets are used to release steroid or antibacterial agent. The tablets are often buffered to promote a pH favorable to the action of a specific antibacterial agent. Tablet used to prepare solution, effervescent tablet. So example is the ENO. These tablets along with the active medicament contain ingredients like sodium bicarbonate, citric acid and tartaric acid which react in the presence of water, liberating carbon dioxide and producing effervescent, leading to disintegration of the tablet, thus fastens solution forming and increase the palatability. Example is ranitidine histatin. Dispensing tablet. These tablets provide a convenient quantity of potent drug that can be readily converted into powder and incorporated into liquid. Thus, the necessity to weight small quantities. These tablets are supplied preliminary as a convenience for examples of dispensing tablets. Commonly incorporated or mild silver potentate bichloride of mercury, merbromine, quaternary ammonium compounds. Hypodermic tablets. So these are soft, readily soluble tablets and originally were used to prepare solution to be injected. These tablets are dissolved in sterile water or water for injection and administered by parenteral route. These tablets are not preferred nowadays because the resulting solution is not always sterile. Tablet trituration. These are the powder mounted into tablets. They are flat circular discs, usually containing a potent substance mixed with lactose and sucrose, dextrose, and or other suitable diluents. Since they are intended to disintegrate very quickly in contact with moisture, water insoluble adjuvants are avoided. The name tablet triturate is appropriately because they usually contain trituration, which is nothing but not dilution with an inert substance.